Hello, my name is Leigh Powell, and I am the Research Coordinator with the Division of Cardiology here at UAB. Today we're going to talk about serious adverse event reporting. So first we're going to go over the objectives. They are to define adverse event and serious adverse event, differentiate between the two events, list the key elements of an SAE report, describe the research staff's responsibility in reporting adverse events and serious adverse events, and review UAB IRB reporting requirements. So what is an adverse event? An adverse event, or an AE, is any untoward medical occurrence in a patient or clinical investigation subject administered a pharmaceutical product. It does not necessarily have a causal relationship with the treatment. So what constitutes an adverse event? So an adverse event is any unfavorable or unintended change in the structure, function, or chemistry of the body temporarily associated with the use of an investigational product. Some examples are worsening of conditions present at the onset of the study, patient deterioration due to the primary disease, incurrent illness, events related or possibly related to the concomitant medications, and AEs, again, may or may not be related to the study drug. So continuing on, an AE is an unfavorable or unintended change. Some examples of symptoms would be a headache, nausea, dizziness. Physical findings would be an elevated blood pressure and hair loss, any syndrome or disease, abnormal lab values, or an overdose. Some continuing examples of adverse events are nausea secondary to chemotherapy agents, diarrhea with antibiotic use, and drowsiness after use of an antihistamine. So what is not an adverse event? A pre-existing disease or condition present or detected at the start of the study, the disease or disorder being studied. So examples would be this includes expected progression, signs or symptoms, unless more severe than expected. Any changes resulting from normal growth and development, such as teething, typical crying in infants and children, the onset of menses or menopause after the physiological appropriate time. Some sources of adverse events. So these can be found by directly observing the event yourself. They can be elicited from the study participants, such as drowsiness after the use of an antihistamine. So you want to use general, non-directive questions. Open-ended questions are the best to ask the subjects about their adverse events. They can also be volunteered by the study participant. And test results. And you want to see if these meet the protocol requirements for the classification of an adverse event, if there are any abnormal test results. So this is a diagram of a way you want to follow to see if something should be an adverse event or not, and if it needs to be reported. So first you want to ask yourself, is the finding part of the baseline profile? If the answer is no, then you do want to record this adverse event on your case report form. Now, when you ask yourself, is the finding part of the baseline profile, if the answer is yes, then you want to ask, is it clinically significant? Has there been a clinically significant change in the pre-existing condition? Has there been a clinically significant change in the lab value? And has there been a clinically significant change in any other safety evaluation? If the answer to this is yes, then you do want to record this adverse event on your case report form. If the answer to this is no, then you want to ask, did it require a new clinical intervention? If it did require a new clinical intervention, then you do want to report this adverse event on your case report form. If it did not require a new clinical intervention, then the event does not have to be reported. So what is a serious adverse event? A serious adverse event, or an SAE, is an event that results in death, is life-threatening, an event where the patient is in immediate danger of death unless an intervention occurs, such as pacemaker failure and a GI hemorrhage. Continuing with SAEs, it results or prolongs an existing hospitalization. So if an admission to the hospital occurs or a prolongation of that hospital stay results because of the adverse event, that would be considered a serious adverse event. Some examples of this are anaphylaxis or infection. So an elective procedure or a surgery for a pre-existing condition which has not worsened is not considered an SAE. An example of this would be plastic surgery. An SAE results in a persistent or significant disability or incapacity, one that causes substantial disruption to the person's normal life and activity. Some examples of this are toxicity, peripheral neuropathy, or stroke. An SAE can also be a congenital anomaly or birth defect. Any suspicions that exposure to a medical product prior to conception or during pregnancy that resulted in an adverse outcome in the child. So an example would be malformation in children that were exposed to thalidomide or ribavirin. Many sponsors do have pregnancy reporting forms. Another example of an SAE would be cancer. An SAE is an event that may jeopardize the subject and may require medical or surgical intervention to prevent one of the outcomes listed above. Some example would be burns from radiation equipment requiring drug therapy. An SAE is any other event that the investigator or the sponsor judges to be serious. Some examples would be allergic bronchospasm requiring intensive treatment in the ER, or the development of drug dependency or drug abuse. So what tools do you have to help you determine what are adverse events, what are serious adverse events, and how to report them? So some of your study tools are the study protocol, the MOP, or the study manual. You always have the investigator brochure, the investigational plan in device trials. Your monitor is always there to help with questions. Of course, the sponsor as well, and your IRB. The study protocol. Now, your protocol should define exactly what adverse event data is to be recorded. It must contain a statement about which serious adverse events are expected and will not be the subject of expedited reporting by the sponsor. Now, what your protocol should contain. It should contain a list of events consistent with the toxicity of the investigational product. There will be a summary of product characteristics for licensed products, an investigator brochure for an unlicensed product. A list of serious events based on knowledge of the disease in question and expected will also be part of the protocol. Now also, what will be involved in your protocol will be a list of all events that should be collected because they are relevant to the study outcomes. There should be a statement of the responsibilities for recording events, and there should be information about how the events will be recorded, and the name and contact details of the person whom the events should be reported will also be involved in your protocol. So what are the key elements that need to be documented? So the intensity assessment. Adverse events are graded according to the National Cancer Institute Common Terminology Criteria for Adverse Events. So with the intensity assessment, there are 5 grades. Grade 1 is a mild AE, which would be non-serious. This is discomfort noticed, but no disruption of normal daily activity. Grade 2 would be a moderate adverse event. This is also non-serious. This would be discomfort sufficient to reduce or affect normal daily activity. A grade 3 would be severe. This is serious. The inability to work or perform normal daily activity. Grade 4 would be life-threatening or a disabling adverse event, which is serious. This would be an immediate threat to life. It should also be reported as serious events. Grade 5 would be death related to the adverse event, which is serious. You want to always refer to your MOP for protocol-specific grading, as this can vary from protocol to protocol. So serious versus severe. Serious categorizes events, which is a regulatory definition. Severe refers to the intensity of the event, such as mild, moderate, severe. A study participant can have a severe headache, but it's not a serious event. So what about expected and unexpected events? Expected. This is the specificity and severity of the event are consistent with the information in the investigational brochure or labeling for the product. Unexpected would be all other events. Causality. The investigator will determine the causality and the relationship to the study drug. And they need to consider the exposure, the evidence of exposure, the time course, the most likely cause of the event, and the consistency with the drug profile. These all need to be considered when they're assessing the causality. So the relationship to the study drug. You have definite, which would be an event that is clearly related to the intervention. Probably would be an event that is related to the intervention. It's very likely that it's related. Possible would be an event that may be related to the intervention. Unlikely would be it is doubtfully related to the intervention. And then you have unrelated, which it is clearly not related to the intervention. Again, you want to refer to your MOP for protocol-specific grading, because some studies may have fewer grading categories than others. So documentation, the event term. This, you want to use a medical diagnosis or the cause of death. Only use one term or diagnosis for each report. Do not indicate all the symptoms as the event. So for example, you want to use dehydration instead of nausea, vomiting, and diarrhea. In the case of death, death is not the appropriate SAE term. The event resulting in the death should be the SAE term. The cause of death or the diagnosis leading to death. You want to avoid cardiac arrest or respiratory failure if possible. Only one SAE with an outcome of death for each subject. And you may report death of an unknown cause if no etiology is known. So when you're documenting the description of the event, you want to describe in detail using the reporter's own words. You want to describe what happened and a summary of all relative clinical information. This would include the medical status prior to the event, any signs and symptoms, differential diagnosis for the event, the clinical course, the treatment, and the outcome of the event. Also, with documenting, you want to document the onset, the duration, and the resolution date of the event. You want to document the investigator's assessment of causality, whether the event was serious or non-serious. You want to document the intensity of the event, the treatment or action taken, And you want to include information on action taken with the study drug. You also, it's very important not to forget to document the outcome of the event, and this will require follow-up. So documentation for SAE submission. So you want to complete the SAE form that is provided by the sponsor. You want to complete the necessary case report form pages, and you want to obtain copies of the medical records that are related to the event. Also, you want to provide all relative, including negative tests and laboratory findings. You want to include baseline lab data, all laboratory data used in diagnosing the event, any laboratory data or engineering analysis that provide further information of the event. Any copies of reports with confidential information must be deleted prior to submission. Also, when you're documenting SAE submission, you want to include any relevant history. So, for example, any other known conditions that the subject has, such as hypertension or diabetes. And with their significant history, you also want to include allergies, pregnancy history, smoking or alcohol use, and drug abuse. Any other pertinent information should also be submitted with the SAE form. The study medication name and the lot number, the diagnosis for use, any concomitant medications, and the medical device name, such as the manufacturer information, the model and lot numbers, or the implantation date. So with the event summary for the SAE submission, this summary should include a summary of the event and the circumstances surrounding the event. You want to include in the MedWatch SAE documents and also include this summary in the source documents. You want to attach copies of the medical records, and of course don't forget to delete any confidential information. And you also want information regarding any environmental conditions that may have influenced the event. So when submission of SAEs, you want to make sure you protect the subject's identity. So you want to obliterate the subject's name in the header and in the body of the text or any supporting documents. You also want to obliterate the medical record number, account number, social security number, date of birth, and any other parents or spouse information. So, why do we need to report adverse events and SAEs? When the investigator signs the 1572, he commits to reporting adverse events to the sponsor that occurred during the course of the trial. Now, CFR 312.6 defines this as, an investigator shall promptly report to the sponsor any adverse effect that may be reasonably regarded as caused by or probably caused by the drug. If the adverse event is alarming, the investigator shall report the adverse event immediately. Now, reporting SAEs to sponsors. You want to report the SAE immediately to the sponsor within 24 hours of becoming aware of the event. And this does not necessarily mean 24 hours of when the event occurred, but within 24 hours of when you become aware of the event. You want to report the SAE to your local IRB as soon as possible. Based on whether it's WERB, which is Western IRB, or UAB IRB's guidelines, you want to decide, was it an unanticipated problem? You want to report the death of a UAB subject to the UAB IRB within 24 to 48 hours. Sponsors are required to report to the U.S. Food and Drug Administration any events that are serious, unexpected, related events, and events that are fatal or life-threatening. Now, you can report these events to the sponsor by telephone, fax, within 7 calendar days of the date the sponsor first becomes aware of the event. The sponsor is going to forward this to the FDA within 7 calendar days of when they become aware of the event. Now, a written report detailing all the information the sponsor has must be submitted to the FDA within 15 days. Now, reporting to the IRB. When we're reporting to UAB's IRB, we're to report to the IRB within 5 working days. Any deviations from the protocol for a device taken to protect life or physical well-being in an emergency. You want to report to the IRB within 5 working days any use of an FDA-regulated test article or humanitarian use of a device prior to IRB approval. And you also would report to the UAB's IRB within 5 working days any SAE that is related or possibly related to the research. You want to report to UAB's IRB within 10 working days the following: any adverse event that is unexpected and related or possibly related to the research, information that indicates a change to the risks or potential benefits of the research, a breach in confidentiality, and a change in FDA labeling or withdrawal from marketing of a drug, device, or biologic used in the protocol. You also want to report any change to the protocol taken without prior IRB review to eliminate an immediate hazard to the subject. You also want to report incarceration of a subject enrolled in a protocol that's not approved to enroll prisoners, an event that requires prompt reporting to the sponsor, and sponsor-imposed suspension for risk. Continuing with what you will report to UAB's IRB, any complaint of a subject when the complaint indicates unexpected risks or cannot be resolved by the research team. Any protocol violation, accidental or unintentional change to the protocol that harmed or increased the risk of harm. When you are submitting for your UAB's continuing review, you want to include a summary of all adverse events and a summary of all problems that were reported to the UAB IRB, including SAEs. Reporting to Western IRB or WIRB. WIRB expects reports to the IRB of unanticipated problems to include a corrective action plan to address the issue or written justification for why an action plan is not provided. All reports to the IRB of unanticipated problems should clearly explain why the event is unexpected and why it represents a risk. An unanticipated problem. An unanticipated problem is defined as any incident, experience, or outcome that meets the following criteria. It's unexpected, related or possibly related to the participation in research, and it suggests that the research places the subjects or others at greater risk of harm than previously known. Now, an unanticipated problem, we want to report this within 10 working days. If it's unexpected, related, or possibly related, it places the subjects or others at greater risk of harm. If it's an unanticipated problem that is not an adverse event, this does not fit the definition of an adverse event, but in the opinion of the investigator, it does involve a risk. It affects others or impacts the integrity of research data, such as the confidentiality, unaccounted study drug, or destruction of records. Unplanned protocol deviations or violations. These also need to be reported. So let's talk about events in the device world. The IDE, or the Investigational Device Exemption, This is regulations that require sponsors to submit reports to IRBs in a manner that's consistent with the FDA recommendations for the reporting of unanticipated problems under the IND regulations. So an unanticipated adverse device effect would be any serious adverse effect on health or safety of any life-threatening problem or death caused by or associated with a device, if that effect, problem, or death was not previously identified in nature, severity, or degree of incidence in the investigational plan or the application, including a supplementary plan or application, or any other unanticipated serious problems associated with a device that relates to the rights, safety, or welfare of the subjects. So, a UADE must be reported to the clinical investigator, to the sponsor, and the reviewing IRB. You want to submit a report of the UADE to the sponsor and the reviewing IRB as soon as possible, but in no event any later than 10 working days after the investigator first learns of the event. Sponsors must immediately conduct an evaluation of this event, and they must report the results of the evaluation to the FDA, all reviewing IRBs, and participating investigators within 10 working days after the sponsor first receives notice of the event. So who is responsible for reporting the adverse events and serious adverse events? Responsibility. The coordinator and the investigator must work collaboratively on reporting adverse events and serious adverse events. The investigator. They are to determine the causality and relationship to the study product. They will review the proper paperwork and sign the SAE or adverse event forms. And the coordinator, they will collect the information and submit the proper paperwork. They will maintain follow-up with the study patient and the adverse events and serious adverse events. If in doubt, always read your protocol. Refer to your investigator brochure, check with your monitor or sponsor, and ask the IRB. So now we're going to go over a few questions that are examples of SAEs and adverse events. So for question number 1, Mr. Rogers is a participant in a study using a new antihypertensive medication. The investigator's brochure lists the potential side effects of headache, dizziness, and drowsiness. Mr. Rogers reports at his study visit that he had a headache 2 weeks ago and he fainted last week. He also complained of a stomach ache yesterday that subsided last night. So with this, are there any adverse events to record? And if so, what are they? So Mr. Rogers would have the following adverse events: syncope and stomach ache. Headache is not an adverse event since it is an expected side effect and is listed in the investigator brochure. For question number 2, which of the following events would be classified as a serious adverse event? Persistent slurred speech following a stroke while under treatment with a test drug, death attributed to an incurrent infection, birth of a deformed infant to a study 7 month, reversible coma following ingestion of 10 times the normal daily dose of a test drug in a suicide attempt, leg cramps at night, appearance of previously undiagnosed melanoma, and vomiting within 1 hour of ingestion of study drug. So of this list, the following would be considered serious adverse events: the persistent slurred speech following a stroke while under treatment with a test drug, death attributed to an incurrent infection, birth of a deformed infant to a study subject 7 months, reversible coma following ingestion of 10 times the normal daily dose of a test drug in a suicide attempt, and also the appearance of previously undiagnosed melanoma. All of these would be considered serious adverse events. So the next question. Ms. Pickles is a patient in an esophageal reflux study. She has a history of migraines, osteoarthritis of her knees, and restless leg syndrome. She comes in for her month 1 study visit complaining of knee pain for several months. She states she is still having heartburn. She mentions at the end of her visit that she has had some diarrhea and vomiting. Are there any adverse events to report, and if so, what are they? So Ms. Pickles has the following adverse events: diarrhea and vomiting. Okay, our next question. Marsha Brady is a 19-year-old female currently enrolled in a clinical trial for anxiety. Today she is brought to the ED by her mom following an alleged overdose of Vicodin and alcohol precipitated by a fight with her boyfriend. After examination, she is admitted for symptomatic and supportive management for respiratory depression and hypotension and psychiatric evaluation. Her admitting lab work included a CBC in chemistry with pending results and a positive pregnancy test. All of her study drug bottles are unopened. So are there any adverse events? If so, what are they? And are any of these serious adverse events? So Marsha has the following. For a serious adverse event, she has respiratory depression and also hypotension, because this includes an overdose of opioids and alcohol resulting in respiratory depression and hypotension in the event summary. Also, you want to make sure that you would report the pregnancy according to the protocol. Our next question. Mrs. B decided to enroll in a clinical trial for patients with hypertension. After discussion with the doctor and coordinator, Mrs. B decides to sign the consent form. While Mrs. B, who happened to be sitting on a rolling stool, was waiting for her lab work to be drawn, she decided to get a mint from her purse. As she reached to the floor for her purse, she fell off the stool and hit her head on the side of the desk, producing a 2-inch gash. 5 minutes later, she started to vomit and complain of drowsiness. She was taken to the local ER where she received 5 sutures. Are there any adverse events? If so, what are they? And were any of these serious adverse events? So if the protocol requires adverse events to be captured from the time of informed consent, then Mrs. B would have the following. The head laceration would be considered an AE, and vomiting and drowsiness can be included in the event summary along with the treatment of 5 sutures. So the next example question. A patient enrolled in a clinical trial for rosacea is hospitalized for a cholecystectomy due to cholecystitis. His medical history consists of rosacea, migraines, and reflux. He has no complications from the procedure and is discharged 2 days after admission. Is this an AE or an SAE? What is the event term you should use when documenting the event? So this would be a serious adverse event due to the hospitalization. And the event term would be cholecystitis. Our next example. Mr. Luck is hospitalized for pneumonia. One night while in the hospital, he decides to get up for a drink of water. He slips while getting out of bed, falls, and fractures his left femur. The fracture requires extensive surgery 3 days after his initial admission. 10 days after his initial admission, he still has pneumonia. On day 10 of his admission, Mr. Luck has a myocardial infarction, which results in death. So are there any adverse events? If so, what are they? And are any of these considered serious adverse events? So Mr. Luck has potentially 3 SAEs. One would be the pneumonia due to the hospitalization. Another SAE would be the left femur fracture, because this did cause an extended hospital stay and required extensive surgery. And also the third serious adverse event would be the myocardial infarction with an outcome of death. Our next example, Sally is participating in a psychology study evaluating the factors that affect reaction time in response to auditory stimuli. In order to perform the reaction time measurements, Sally is placed in a small, windowless, soundproof booth and asked to wear headphones. The consent form Sally signed described claustrophobic reactions as one of the risks to the research study. But she did not think it would be a problem for her. 15 minutes into the study, Sally has an anxiety reaction due to claustrophobia. She decides to withdraw from the study. So are there any adverse events? If so, what are they? And are any of these serious adverse events? So there are no adverse events for this patient. The event should be documented in the source according to the protocol. However, because this was an expected event. Question number 9. So JR is the 5th subject to enroll in a Phase 2, open-label, uncontrolled clinical study evaluating the safety and efficacy of a new oral agent administered daily for the treatment of severe psoriasis. He develops severe hepatic failure complicated by encephalopathy 1 month after starting the oral agent. The known risk profile of the new oral agent prior to this event included mild elevation of serum liver enzymes in 10% of the subjects receiving the agent during previous clinical studies, but there was no other history of subjects developing clinically significant liver disease. The IRB approved protocol and informed consent for the study identifies mild liver injury as a risk of the research. The investigators identify no other etiology for the liver failure in this subject and attributed it to the study agent. So does this hepatic failure need to be reported, and why? Yes, it does need to be reported because it is an unexpected event. This would be a serious adverse event. And our last example question, Dr. T is a behavioral researcher conducting a study in college students that involves completion of a detailed survey asking questions about early childhood experiences. The research was judged to involve no more than minimal risk and was approved by the IRB. During the completion of the survey, one subject has a transient psychological reaction manifested by intense sadness and depressed mood that resolved without intervention after a few hours. The protocol and informed consent document for the research did not describe any risk of such negative psychological reactions. Upon further evaluation, Dr. T determines that the subject's negative psychological reaction resulted from certain survey questions that triggered repressed memories of physical abuse as a child. Dr. T had not expected that such reactions would be triggered by the survey questions. So does this event need to be reported, and why? So yes, this does need to be reported as an adverse event because it was an unexpected event for this study. And that concludes the SAE and adverse event presentation. Thank you.